Hyperthermia has brought us something that we've been waiting for a long time. We needed a therapeutic approach that would boost the patient's response to treatment and possibly lead to a cure, something that boosted the chemo and the radiotherapy. Essentially, it's something extra to add to conventional treatment where we know what the response will be. But we always wanted to go further, and treatment using hyperthermia brings something extra. Instead of patients undergoing chemotherapy and having a response that lasts 4 to 5 months, the response can last now 8, 10, 12 months or longer. Hyperthermia boosts the response of the chemotherapy and/or the radiotherapy. We can halt the progress of the disease for a longer period, bring about a better overall survival rate, and improve the quality of life for the patient. It allows chemotherapy and/or radiotherapy to achieve its objectives more effectively. The patient undergoes treatment in comfort without suffering immediate or later reactions.
Sem sentir reações imediatas ou a posteriori.
Chemotherapy and/or radiotherapy no longer have much to offer. We achieve gains ranging from months to longer periods, sometimes up to a year. Hyperthermia can be offered to all kinds of cancer patients. It works through a radio frequency which will cause local heat to destroy the tumor cell. From colorectal cancer to lung, breast, head and neck, central nervous system, gynecological and prostate cancers, among others. We've consistently obtained positive responses for all these cancers. The treatment is completely safe. The patient starts and finishes the treatment in comfort because the heat applied can take away the pain that the patient is feeling in that zone. The patient ends the session feeling well. It's also worth pointing out that it can be repeated at any stage of the patient's life because there's no dose limit. Therefore, hyperthermia may be repeated with no added toxicity for the patient. It may be used with the current chemotherapy schedule and then with the next chemotherapy schedule without problem, with no contraindication. New treatments are being developed in terms of immunotherapy that will boost the response in relation to classic chemotherapy. This is another approach to help boost this response. With one big difference: this approach does not have important side effects like the others do. Hyperthermia is not a replacement for any therapeutic approach. Rather, it complements the treatment because it actually boosts the response. Hyperthermia will boost the local effects, the biological effects. It causes the destruction of the cells, oxygenation, the transport of metabolites, and so on. Therefore, that entire mechanism, everything that happens there, in that tumor cell, will allow the radiotherapy or the chemotherapy to destroy the harmful cells more effectively. It paves the way, clears the path, both for radiotherapy and for chemotherapy. Hyperthermia in itself, in isolation, is also effective, but it's not as effective as when there are synergies among the different treatment approaches. It also has its own effect, as does chemo, as does radiotherapy. But if we can join them together, the result is much more effective and will be far better. Several tests have been carried out so far, namely important phase 3 trials with certain kinds of cancers, which have confirmed that hyperthermia is playing an increasingly important role in the treatment of cancer patients. In other words, there are greater clinical benefits for the patient, both in terms of cure and in the lower likelihood of relapse of the disease. and in terms of halting the progress of the disease in patients with metastases in the liver, with a 50% reduction in the size of the lesion. With hyperthermia, in conjunction with the chemotherapy, fourth line, fifth line, the patient is undergoing, benefits are achieved that would be impossible with conventional chemotherapy alone. The patient was essentially doing maintenance chemotherapy, but by adding the hyperthermia, it brought about a 50% reduction in the metastatic lesion. Hence, an extra benefit is always obtained when hyperthermia is added to the chemo and to the radiotherapy.